Hello everyone. Now I'll be discussing question of cardiology. Well, the question is digoxin toxicity can cause hyperkalemia. To treat this hyperkalemia, which of the following treatment is contraindicated? Well, if you look into all the options, in fact, all these five are the use of standard treatment for the treatment of any cause of hyperkalemia. Okay, but here the question is hyperkalemia is there, but which treatment you will not do? The answer is intravenous calcium. Well, just before I discuss the question, for any cause of hyperkalemia, like say in chronic renal failure, patient has hyperkalemia, he comes, and the first thing we give is intravenous calcium because it stabilizes cardiac membrane and it prevents arrhythmias. But it is absolutely contraindicated in digoxin toxicity. Why? And this you will not understand unless you know the basic concept. Okay, so answer is IV calcium not given. So let's learn the basic concept. What the mechanism of action of digoxin? Then only you will understand. Well, when digoxin increases the force of cardiac muscle contraction, that is, it has got positive ionotropic effect. But how? What's the basic mechanism? It inhibits sodium potassium ATPase enzyme. And what is this? What is the purpose of this enzyme? This causes this a cell, cardiac cell, sodium goes out of the cell and potassium comes in. This is normal and this is done by the enzyme sodium potassium ATPase. So definitely when this enzyme is inhibited, sodium cannot go out, potassium cannot come in. Potassium will remain outside, that lead to hyperkalemia. And sodium will remain inside. There is increase in the sodium concentration inside. Now this sodium will go out and calcium will come in via sodium calcium exchanger, or what I say in a lighter way. Initially the sodium was dating potassium. Now there is some conflict because why? The enzyme sodium potassium ATPase has been inhibited by digoxin. Now sodium start dating calcium. Sodium goes in, calcium come in. So there is increase in intercellular calcium. And this increased intercellular calcium will bound to contractile protein in the myocyte, and that cause increase contractility will happen. And this is how it is going to cause acting like a positive ionotropic drug. The same, lovely. Normally sodium goes out, potassium comes in normal, and by enzyme sodium potassium ATPase, which has been inhibited by digoxin. So now this sodium will go out and the calcium will come in by sodium calcium exchanger. Increased calcium will bound to contractile protein in the myocyte, and that lead to positive ionotropic. But point to be noted, when we are using digoxin, it is causing increased serum potassium level, increased serum potassium level in the serum, and that's the mechanism why hyperkalemia occurs. So now, before I discuss this question in detail, let's learn effect of digoxin on potassium and effect of potassium on digoxin. There are two things, basic concept you got to understand. Well, digoxin toxicity and serum potassium level, what happened? As I told you, it blocks sodium potassium ATPase, and I also told you potassium is not able to enter the cell, and that lead to higher serum potassium level, so-called hyperkalemia. The point I already mentioned in the previous slide, but now it is documented. If you want, you can write it down. Well, calcium comes in and sodium goes out, okay, by sodium calcium exchange, and intercellular calcium increases, and that lead to positive ionotropic effect. But the purpose of showing this is of this slide again and telling again, because this is a mechanism why hyperkalemia occurs. So hyperkalemia causes EC changes as usual, right? And we have to give calcium gluconate injection every time in every hyperkalemia. But in the setting of digoxin toxicity, if you give calcium, potassium will remain out. Now more and more calcium will enter the cell, and that lead to more and more attachment to contractile protein get attached to calcium, and that lead to more and more sustained contraction of the cardiac muscle, and this is known as stone heart. There will be impaired diastolic relaxation because continuously calcium is causing contraction of the myocyte, no relaxation. So like this, the hand is totally the way you can just make a fist, total strong fist. Same thing, stone heart is there, right? So that's why we never give calcium in digoxin toxicity. Now let us discuss a little bit more. Write down the answer in your copy. What is the effect of hypokalemia on digoxin? Stop the video, write down the answer in your copy. Well, digoxin toxicity is worsened by hypokalemia. With reason being, digoxin normally binds to the ATPase pump, sodium potassium ATPase pump, same side where potassium binds. Now there is hypokalemia is there, the low potassium level. That means more and more digoxin can bind to the same place which is vacant because of low potassium level. That means more digoxin can bound to site, that is going to induce toxicity. Okay, so ultimately, as more and more digoxin bound, that will open membrane for calcium channel, potassium not coming in because potassium level is low. More and more calcium will come, and that will increase intracellular calcium, and that will enhance the toxicity of digoxin. Well, if you look into other option, intravenous dextrose with insulin, albuterol, disulfide, none of these are contraindicated in hyperkalemia due to digoxin toxicity. Okay, they can be given if needed. Of course, all depending on how we are going to manage it. Normally, these are not needed, but at least they are not contraindicated. Okay. So, golden line to remember: intravenous calcium is absolutely contraindicated in hyperkalemia due to digoxin toxicity. Thank you very much.